I am Dr. S. N. Routray, Professor of Cardiology at SCB Medical College, Cuttack, Odisa. So, I will be speaking on worsening heart failure. The worsening heart failure concept has come recently, though the symptoms of worsening of heart failure is there since long, but the definition what is worsening heart failure has come up in 2023 only. This is patients with chronic heart failure with deteriorating symptoms and signs of heart failure, and new onset heart failure is excluded, and these patients need optimization of diuretic therapy, escalation of guideline directed medical therapy. If you see what is the pathophysiology, it is still not clearly understood, but this is maladaptive nature of the fluid congestion. Though there is fluid congestion, sometimes with diuretic fluid congestion decreases. However, what happens, there is this fluid comes from the periphery or from the splanchnic region to the pulmonary. There occur pulmonary congestion and patient becomes symptomatic. It may be associated with sympathetic overactivity, which can precipitate. Sometimes the precipitating factors like non-adherence and comorbidity, these have to be excluded while defining worsening heart failure. If you look at the management of worsening heart failure, so this remains primarily optimization of the medical directed medical therapy and IV loop diuretics. If you see, the patient is already taking oral diuretics, still the patient has symptoms, you will have to optimize the management by giving loop diuretics. Here the patient has to be risk stratified. If they are low risk, they can be treated in the emergency department or OPD basis. If they are high risk, they have to be admitted, and in those patients may be they will need infusion of diuretics and the optimization of the medical management. However, the crucial is the diagnosis, how quickly, how efficiently we can diagnose such patients, so that we can institute the treatment, we can better patient management. So, the patient, there should be a heart failure clinic, patient should be sensitized regarding the symptoms. If the symptoms or signs appear, he must report, and for this there are few markers, this like biomarkers like NT-proBNP, CA-125, all these are there. By that also we can early diagnose. There are imaging modalities like ultrasound of the lungs, echocardiography. By that also we can optimize the diagnosis. And if you see, those who are having frequent heart failure with worsening of the heart failure, such patients may need this device guided diagnosis in such case. So, the device will be put in the pulmonary artery, and we can sense the pulmonary pressure, and they can be transmitted to the patient and the physician online, and this treatment can be started immediately. So, this main remain how we can prevent worsening of the heart failure, because if there is worsening, then there is quality of life deteriorates, the patient have higher mortality and higher heart failure hospitalization. So, our aim should be early prevention of such episodes. So, we will have to diagnose early, we will have to institute the management quite fast, and we will optimize the guideline mediated medical management, and it has to be escalated. By instituting the proper guideline directed medical management, giving IV diuretics whenever required, we can prevent the episodes of worsening heart failure. But in spite of that, some patients do have worsening heart failure. Such patients will need either heart transplant or left ventricular assist device. Thank you.